A transverse vaginal septum is a thin wall of tissue that forms horizontally across the vagina, blocking its passage. Think of the vagina like a hallway. The septum is like a door placed in the middle of that hallway, preventing anything from moving through it. It is a rare congenital condition that may not be noticed until a girl reaches puberty. The septum happens because the parts that normally form the vagina, the upper part from the Mullerian ducts and the lower part from the urogenital sinus, do not join correctly during fetal development. This mismatch creates a tissue bridge. There is no lifestyle cause. It is simply an error in early embryo growth. Sometimes a family history of other birth tract defects can increase risk, but most cases are isolated. Common signs appear after the first menstrual period. A girl may have no blood coming out even though she feels menstrual cramps, painful swelling in the lower belly because blood collects behind the septum, difficulty inserting a tampon or a catheter, a feeling of fullness or pressure when walking or sitting. These clues act like a traffic jam warning that something is blocking the vaginal road. Doctors first suspect a septum based on the symptoms, then confirm it with a pelvic exam or imaging. An ultrasound can show a fluid-filled pouch behind the block. MRI gives a clearer picture of the septum's thickness and location. Treatment is usually surgical. A small incision septotomy, or removal of the tissue, is made to create a normal passage. If the septum is thick, a two-step surgery may be needed, sometimes using a laser to cut precisely. After surgery, a short-term vaginal mold or dilator may be used, like gently inflating a balloon, to keep the new opening open and prevent scar tissue. Because the condition is present from birth, there is no way to prevent it before it happens. Early detection is the key. Parents and pediatricians should pay attention to any signs of delayed periods or pelvic pain in teenage girls, and refer them promptly for evaluation. Education about normal puberty changes helps families notice unusual patterns earlier. The use of 3D MRI reconstructions that let surgeons practice the operation on a virtual model before the real surgery. Laser-assisted septum removal, which reduces bleeding and scar formation compared with traditional scissors. Post-operative home-based dilator programs guided by smartphone apps that remind patients to perform gentle